Hi, I'm Dr. Agatha Bis. The most common statement I hear from patients when told they need to replace a filling or a crown is, how long will it last? And then they say, I thought it would last forever. Patients are constantly surprised when dentists tell them their filling or crown or other previous dental work is failing and needs to be replaced. I often hear reply, it's not hurting, so there's nothing wrong. But when a tooth breaks or hurts today, the most frequent comment is, it was fine until now, so I don't understand why it broke, or I don't understand why it's hurting today. In order to answer this, or clarify this for our patients, we need to step back and take a look at what it means to thrive versus survive. What is the difference between healthy and in your mouth? And how do you know the difference? And even more importantly, when do you step in to fix it? The simplest way I can help patients answer this question is with a story that actually happened to me a few years ago. Keep in mind, this is a house analogy, but it really has a lot of similarities to teeth and the daily things we as dentists see and try to explain to patients every day. So a few years ago, I noticed a crack on the side of my house. It was small, and when inspected, I was told it was irrelevant. A few years later, I went down to my basement and I noticed that the hardwood in the closet was raised, very raised. A neighbor of mine happened to be over and he worked in construction, so he ripped out the hardwood and noticed water pooling underneath. He then removed part of the drywall to see where the water was coming from, and there was a crack in the foundation allowing the water to come in. Water was pooling and flowing along the side of the house. As he kept digging, new issues came up. By the time we got to the source of it, I had a massive crew of construction workers and massive equipment digging up my driveway, my pipes leading to the house, and most of my basement ripped out. So the question is, when did this fail? Well, that depends on your definition of lasting in optimal health as compared to failure. Again, using the house analogy, when is it time to replace something? How do you define when it's failing? Is it when edges are curled? When a portion is worn? When there are cracks? When a piece is missing? When there's visible leakage? And consider this. What if someone inspected, as in examined, that area, as in your mouth, every 6 months or a year, and at one point said to you, hey Agatha, I see there's some leakage here, and here's what it could mean. When would you want to step in to investigate and fix it? As soon as the leakage is visible to the inspector, the dentist, or when it hurts you? Would you consider the cost of fixing it now huge, or would you consider it related to what they're telling you it could become if you leave it and the damage becomes massive? Hindsight is 20/20. Many people will say, just leave it. Or they will say, fill it, when filling it is not the correct solution. They think that they can deal with it later. And so we do that. We leave it. But the cost to doing so and the amount of work needed to fix it later is massive.